bikubangamira akanya gato igihe bikomeje usabwa kwihutira kwa muganga bakakuvura bigahita bishira. Ubu butumwa ni ubw'ikigo cy'igihugu gishinzwe ubuzima RBC hamwe n'abafatanyabikorwa. Indwara y'imidido cyangwa ibitimbo iri mu zishobora guteza ubumuga no kwiheba ndetse n'ubukene bwo mu muryango kubera ko uyirwaye atabasha gukora neza. Nyamara kuyirinda biradusaba gusa kuzirikana kwambara bote cyangwa izindi nkweto zifunze kandi ndende kugira ngo turinde uruhu rwacu guhura n'ubutaka igihe tugiye guhinga, kuragira, gukina umupira cyangwa kugenda mu nzira z'igitaka. Tugomba kandi gukaraba ibirenge igihe cyose twahuye n'itaka cyangwa ivumbi kugira ngo twirinde ko byakwinjira mu ruhu bikazatuviramo kurwara imidido mu myaka iri imbere. Nanone tuzirikane kwihutira ku ivuriro ritwegereye igihe dufite ibimenyetso by'indwara birimo kubyimba ibirenge, ibisebe no kugira umuriro.
Thank you, DJ. Good morning, everyone. Muraho neza, mwaramutse neza, amahoro. That's how we greet in Kinyarwanda. Before we start, I would like to thank and appreciate everyone. Please, you may give yourself a big round of applause for coming. Amashyi kuri mwese kwitabira kuri uyu munsi. So today is a special day, a great morning. We are going to have not only, let's not say a meeting or a conference, we are going to have a dialogue, a safe space where we are going to learn, we are going to connect, and also we are going to commit and make impact. So, welcome in annual high-level national stakeholder advocacy meeting, prevention and control of neglected tropical disease with WASH integration. I know you're reading this title. It's kind of long for everyone, but simple words that you could take from it is that we are here in this meeting to discuss, to learn, to connect and commit in elimination and prevention of NTDs with WASH integration. Let me start with this story. Who can remember in 2010, we had an election of United States of America President Barack Obama. There is one of the known speech or quote that he said, yes, who can feel it? Yes, 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 we can. So today, I need everyone to think about a word and say, yes, we can. Yes, we can prevent and eliminate NTDs. Yes, we can integrate WASH. Yes, we can collaborate and make impact. Who is ready to make it? Raise your hand. Let me see your hands. Amazing. Clap for yourself. So as we start, I would like to introduce myself. My name is Dr. Tunga Christian. I'm youth, and I'm part of Rwanda NGOs Forum. Clap for me. Thank you so much. To show my sincerely appreciation and happiness to see everyone here, let me clap for you too. So we have a really interesting and beautiful agenda. So we're going to start with the keynote speeches, and we're going to have a very, very interesting moment to launch our strategic plan. I will talk more about it in its time, but let me tell you, have a lot of curiosity. You can see some wrapped gift there. It's for everyone for the launch, so get ready. Next, we'll be having a panel discussion, very interesting one, a lot of panels and a lot of panelists that have a lot of things we are going to discuss and learn today. Lastly, we're going to have a closing remarks, and then that's it for our day. It's a very brief agenda, but interesting one. So let me once again say, you are most welcome. Another time, give yourself a big round of applause and welcome for today's meeting, annual high-level national stakeholder advocacy meeting on prevention and control of neglected tropical disease and WASH integration. By starting, I need everyone to keep this number, the number 70 and number 2. I will tell you why. While preparing this, hosting this event, I get close to those numbers, 2 and 70. So if you read the strategic plan, we get the presentation, please keep those numbers, 2 and 70. And I know the presenters will tell why these 2% by 2027 and 70% by 2030. So we need to go below 2% on schistosomiasis and soil-transmitted helminth prevalence by 2027 in Wijesera and Ruhango. Also 70, we want to have domestic financing for at least 70% of national NTD program budget by 2030. So keep those numbers, 2% and 70%. So by starting, I would like to open up this event by welcoming the welcoming remarks. Do you know the one and only, our own ED, Kabanyana Nuriet. A big round of applause to her as we receive the opening remarks from her. Welcome.
$70 and 2. I'm for 70. If we achieve 70, then 2 also will be achieved. Thank you. Government officials, representatives of embassies here present, representative of development and technical partners, private sector representatives, civil society organizations and communities, distinguished guests, all protocol observed. Good morning. Good morning. Again, a very warm welcome to the annual high-level National Stakeholder Advocacy Meeting on the prevention and control of neglected tropical diseases with WASH integration. On behalf of the Rwanda NGOs Forum, we are truly deeply grateful for your presence and continued commitment to the health and well-being of communities across Rwanda. Today, we would like to express our sincere appreciation to the government of Rwanda, particularly the Ministry of Health, the Ministry of Local Government, the Ministry of Infrastructure, the Ministry of Agriculture, the Ministry of Education, the Ministry of Environment, and the Rwanda Biomedical Center for their leadership, collaboration, and continued commitment to strengthening the national response to NTDs and advancing WASH integration. Our special appreciation also goes to the End Fund for its generous and continued support and partnership, which has made this important platform possible. We also extend our gratitude to all development and technical partners, the UN agencies that are here present, the private sector actors, the academia that we work together on a daily basis, media and community organizations whose partnership, expertise, and resources continue to strengthen Rwanda's journey towards NTDs elimination and also advancing WASH interventions. Ladies and gentlemen, we need to keep in our mind that NTD elimination cannot be done or achieved by one institution or only one sector. It requires collective leadership, shared responsibilities, sustained investment, and meaningful community participation. To this, we need to agree that our strength lies in working together. Today's meeting has come at a critical time where Rwanda is advancing the implementation of the NTD Strategic Plan 2026-2030. So we recognize that sustainable NTD elimination requires more than medical interventions. It demands stronger integration of water, sanitation, and hygiene, the multi-sectoral coordination and collaboration, sustained financing, innovation, evidence, community engagement, and accountability. So moving forward, this meeting is providing us with an important opportunity to move from commitment to concrete actions, to strengthen partnerships, to mobilize resources, and also amplify community voices, share evidence, and agree on practical commitment that can accelerate NTD elimination, WASH, and WASH integration. As I get to the end of my speech, I want to appreciate the team that has worked together day and night in making this platform being a successful one. This is the Rwanda Biomedical Center team and the Rwanda NGOs Forum team. Your efforts have brought together diverse stakeholders around the shared vision and demonstrated the value of strong coordination and partnership. As I conclude, I encourage all of us to participate actively, challenge ourselves to think beyond business as usual, and most importantly, leave this meeting in with clear, measurable, and actionable commitments. Together, let us strengthen our collective action towards a healthier and more resilient and NTD-free Rwanda. I wish us a fruitful, engaging, and action-oriented deliberations. Thank you.
Thank you so much, Mrs. Kawanyana, our ED for Rwanda NGOs Forum, for a nicest presentation and welcoming remarks. Please, once again, a big round of applause to her. Thank you so much for welcoming us. Now we are at home. Everyone is free to intervene or give their ideas. Next to our agenda, we're going to welcome, let me tell you, our next speaker brings 3 decades of global public health leadership and perspective that connect Rwanda ambition to global movement to eliminate NTDs. Ladies and gentlemen, please join me to welcome WHO representative, Dr. Brian Chirombo. Welcome for your keynote speech. Another bigger applause until he gets here. Welcome so much. You're welcome.
The Honorable Guest of Honor, peers in the Ministry of Local Government, Dr. Albert, representing the DG of the Biomedical Center, the Executive Director of the NGOs Forum, representative of the END Fund, representatives from development partners, civil society organizations, academia, private sector, community leaders, distinguished guests, ladies and gentlemen, good morning. I am really honored to join you at this very important national dialogue on the prevention and control of neglected tropical diseases and its critical integration with water, sanitation, and hygiene interventions into our collective efforts to eliminate these diseases. I would like to thank the Rwanda NGOs Forum for convening this timely meeting under the theme Partnerships for Impact. This theme captures an essential truth. Eliminating neglected tropical diseases is not the responsibility of the health sector alone. It requires coordinated action across government ministries, across local authorities, communities, civil society, academia, development partners, and the private sector. It requires us all to work together around a clear shared vision of a healthier communities and a more prosperous Rwanda. Rwanda has made very good progress in reducing the burden of neglected tropical diseases. And the country has done this through strong leadership, through use of interventions like the mass drug administration, through community engagement and collaboration among all partners. Yet, schistosomiasis and soil-transmitted helminthiasis continue to affect many communities in the country. And this is particularly worse in communities where access to safe water, sanitation, and hygiene remain inadequate. We've already heard about some of the assessments that have been done in some of the districts, which reveal clear gaps in terms of awareness, in terms of access to hygiene facilities. And these all reinforce the need for sustained investments in prevention along with treatment. These findings remind us that medicines alone will not achieve elimination. Lasting success requires addressing the underlying conditions that allow transmission to continue. Safe water, improved sanitation, hygiene practices, community awareness, and strong local systems are all essential components of a sustainable response towards the elimination of NTDs. The World Health Organization's roadmap for neglected tropical diseases 2021 to 2030 calls for a new way of working, one which needs to be built on country ownership, on multi-sectoral collaboration, on integration, on accountability, and with a focus on impact. The roadmap recognizes that health outcomes are shaped not only by health services, but also by the environments in which people live, the environments in which our children learn, and the environments in which many of us work. The roadmap encourages countries to move beyond disease-specific interventions towards coordinated, people-centered approaches that address and focus on the root causes and deliver sustainable results. The Rwanda National NTD Strategic Plan 2026-2030 vision aligns very well with the WHO roadmap, as it emphasizes sustainable financing, stronger partnerships, domestic resource mobilization, and enhanced multi-sectoral collaboration. And we have had the highlight on 72. It also aligns very well with the Kigali Declaration on NTDs, which was launched here in Rwanda, and it has become a global call for stronger political commitment, for greater national ownership, and increased investment in ending NTDs. As Rwanda continues its progress towards the interruption of transmission of some NTDs, we have an opportunity to consolidate gains and build a foundation for long-term success. In this regard, I would like to highlight 5 priorities that can help us to accelerate, or for Rwanda to accelerate its progress. First, we must strengthen national ownership and political leadership. Rwanda has consistently demonstrated, not only in this area, but in other areas, that when national leadership is strong and clear, coordinated and accountable, significant public health gains are possible. The Kigali Declaration places country ownership, community commitment, political will, resources, and action at the heart of the global movement to end NTDs. It also aligns with the WHO NTD roadmap and reinforces the importance of translating global commitments into national strategies and measurable impact. So today, Rwanda has the opportunity to again continue to lead by example, by showing that elimination is not only a technical objective, but it needs to be a core national development priority. Secondly, WASH NTD integration must move from principle to practice, from principle to action, as we already heard from the ED. Integration should not mean occasional coordination meetings. It should mean shared planning, shared data, shared targeting of where the problem is, especially the high burden communities, shared budgets where appropriate, and also joint accountability for results. So it's key for us to define the results together and then work together towards those results. WHO guidance emphasizes the importance of using data to identify inequalities, to target investments, and to track the progress that we make together. In Rwanda, for environmental management, financing must become a central pillar of elimination. And we've heard about 70. NTDs programs have benefited enormously from donor support. We continue to receive medicines donations and partner investments. But elimination cannot be achieved with external funding alone. And of course, as mentioned earlier, we know that the external funding is already going down significantly and actually is expected to continue to go down. The Kigali Declaration emphasizes the need to unlock domestic resources, among other priorities. And of course, when we're talking of domestic resources, we're not only government resources, but it's making sure that we tap resources from all the sectors and all the partners, including private sector and others. Rwanda's own strategic plan points in the same clear direction with a clear target to increase domestic financing and engage the private sector throughout the process, from planning, financing, delivery, and other aspects. This, of course, requires a whole-of-government approach. Ministries responsible for health, for finance, for local government, for infrastructure, for education, agriculture, environment, and community development have critical roles. And we applaud the current work to engage and for the involvement of these ministries, because they are critical. It's not a ministry of health function alone. Actually, it doesn't work when it's mainly the Ministry of Health which is engaging in this. Development partners and private sector are also critical, and they have an opportunity to align their investments with Rwanda's national priorities, especially supporting the high burden communities and districts. Fourth, communities must be treated not only as beneficiaries, but as part and as leaders. The burden of NTDs is experienced first in a communities. Community health, health workers, teachers, local leaders, families, women, young people, and people affected by NTDs fully understand the barriers that programs may not always see from the national level. The objective of this meeting to elevate community perspectives and evidence in policy dialogue is therefore really critical. When households have not heard of Thursaday, when information systems don't respond, the information systems need to respond so that communities are informed. When hand washing facilities are not available, infrastructure and behavior must be addressed together. When children are at repeated risk of infection, schools must become platforms for prevention, health literacy, and hygiene. And communities should help define the problems, shape the solutions, and monitor whether services are reaching those most in need. And then finally, accountability, again, which was highlighted by ED, and evidence. These must guide the next steps in how we do things. The WHO roadmap places strong emphasis on shifting from process indicators to impact indicators, because we need to focus on the difference that we are making. For example, this means that our collective success should not only be measured by the number of meetings, by the tablets we have distributed, though of course this is very important, by the campaigns that we have conducted, or by the toolkits that we have disseminated. Yes, these are important, but they are not enough. We must also ask, are infections declining? Are reinfections, especially among school children, being prevented? Are WASH services improving in high-risk areas? Are communities more aware and empowered? Are district plans integrating NTD and WASH priorities? Are domestic resources increasing? Are the most vulnerable being reached? So the dissemination of the National NTD Strategic Plan 2026 to 2030 and the WASH NTD Coordination Toolkit during today's program provides an important opportunity to translate commitments into practical action, both at national level and at the district and local levels. Colleagues, ladies and gentlemen, the expected outcomes of this meeting are both ambitious and achievable. Enhanced political leadership, strong multi-sectoral collaboration, sustainable financing, effective coordination, and greater community engagement can significantly accelerate Rwanda's progress towards NTD elimination. The dissemination of the strategic plan and the toolkit provides an opportunity to institutionalize these efforts and strengthen collaboration across sectors and levels of government. Today, I would like to encourage all stakeholders represented here to make concrete commitments. Government sectors can strengthen integration within policies, plans, and budget. Development partners can continue aligning their support with national priorities. Civil society organizations can amplify community voices and promote accountability. Academia can continue to generate evidence that guides decision-making. And the private sector can contribute innovation, expertise, and investment. Communities can continue to shape solutions that respond to local realities. WHO remains fully committed to supporting Rwanda through technical assistance evidence generation, capacity strengthening, policy guidance, and partnership building. We will continue working closely with government and all stakeholders to advance integrated, people-centered approaches that contribute not only to NTD elimination, but to universal health coverage, because NTD elimination is a core part of achieving universal health coverage, and this helps the country move towards the health-related sustainable development goals. Ladies and gentlemen, the elimination of neglected tropical diseases is within reach. Achieving it will require strong leadership, shared responsibility, and sustained collaboration. Let us use this meeting to renew our commitment, strengthen our partnerships, and accelerate action. Together, we can ensure that every community benefits from safe water, from improved sanitation, from better health, and from better opportunities. Together, we can transform partnerships into impact towards the elimination of neglected tropical diseases. Guests of honor, colleagues, ladies and gentlemen, I thank you.
Thank you so much. Another big round of applause. Like a quick takeaway is that partnership and collaboration for impact. Just a brief takeaway, there is a need of partnership and collaboration to make sustainable impact. Another big round of applause to WHO representative Rwanda, Dr. Brian Chirabo. So we are in the most exciting moment. We are going to welcome our guest of honor for today's meeting, and join me to welcome our guest of honor. Our distinct honor to be is Mr. Bob Gachire, Permanent Secretary at Ministry of Local Government. Honorable, the floor is yours. A big round of applause to our guest of honor. You're welcome.
Ngaramtse. Good morning. ED, Rwanda NGOs Forum. Our guest speaker for today, Dr. Brian. My colleagues from the government and public state departments here present, Minisante, RBC, and many others, plus the END Fund, and ladies and gentlemen. I would start by appreciating what we've heard from Dr. Brian. I was really keenly following what you're telling us. There were so many things to note and to orient us as we move forward for our strategy that runs up to 2030, but also what should be the role of everyone in this room, but even somebody who is not in this room, but what can we do to pattern and collaborate for impact? There were so many, and I was thinking, what else should I add? But I have something to add. Thank you so much, Dr. Brian, for delivering those points and insights for us, especially as government, who do plan and orient for the government of Rwanda specifically. Allow me also to commend the Rwanda NGO Forum, commonly known as LINGOF, for convening us today. We appreciate for this annual high-level national stakeholders advocacy, and we are lucky to share and also renew our commitments for the next years to follow. I would say I'm here representing the Ministry of Local Government. one would maybe ask that why Minarok or Minister of Local Government. It's because we are talking something that is not clinical, but also that needs something else to be done by the local governments, which we coordinate as a ministry. Then participating in this meeting is not about bilharzia or diseases, as Dr. Brian was talking about, but what can we do in the first instance that the places, the water points, the wetlands, irrigation canals, and households, what can we do to prevent this? We are here, we have some local government representative here, the vice mayor are here, for those invited from Gisela and Ruhango. And it is clear that before somebody somewhere down there in the villages, before going to the clinic to get a medicine, what else can we do before that? How can we ensure that these wetlands, people have access to water collaboratively from the partners? Earlier on, we were talking with the representative from Luxembourg, how we can even use the existing platforms to fix some of the issues, especially if we do have what we call Propoa Basket Fund, and it normally addresses issues in 16 rural districts in Rwanda. So when we are sitting in the room, the steering committees, and coming up with these plans every year, how do we do better, and how do we refer to the assessments like this, which was done in Gisela and Ruhango, that may be even reflected in other districts, whereby, as Dr. Brian said, if 60% of households had never heard of bilharzia, and then 66.4%, especially in the district of Ruhango, are not aware of this, of contaminated water, then it is our role to scale up that awareness. It is our role to know what to do using the partnerships, the forums we go into, and fix this problem of water, of hand washing facilities, of soaps, and so many things. So I would say it is not a clinical failure, it is a failure of the communication, of planning, of coordinating, and it belongs to everyone here in this room today. Some words are not new, some commitments are not new, but what do we and how can we do better in a collaborative way and a partnership way so that we can achieve and reduce these percentages, at least of awareness and coordinating better. A national target remains unintentional until it becomes for some of the things we have to consider. Even ED told us earlier that we shouldn't be doing business as usual. So, and the priorities you told us were very clear of how we can work together, financing. But I would also add on like 4 things, and this would so relate with what we have already in place. If we make this separate in our district development strategies that aligns with NST2 and some other strategic documents we use as a government, if we target using what we commonly known as in HIGH performance contracts, if our budget line in a district, in local government somewhere, in an entity, or an activity in the sector, or the sale, these lower entities, we believe we can do this, and we can do it within the timeline available. So the machinery exists through integrated data management systems. They are measurable, the activities are measurable. And then the question would be whether NTDs and WASH that we are doing are really being loaded and in a clear way. We can do mass drug administration, treat the persons using the community health workers, or information awareness, whichever way. We can know where to put much emphasis as far as WASH, education, environment, infrastructure. But we must also see how agriculture can do a role. For instance, where we're expanding irrigation, the marshlands, without creating some other impacts, controlling the snail control, expanding transmissions. With the other hand, we're treating it with what we have already in our hands. We can ensure in this meeting that at least every district use its forums, more especially the Joint Action Development Forum, commonly known as JAF, to collaborate and ensure that WASH, NTDA coordinating meetings find a way in every district to get rid of this. District partners can reflect NTDA, WASH priorities, more especially in district development strategies, the annual action plans, and many other indicators, including using the platform or the framework of IMHIGO, domestic mobilization, the financial resources, however modest they could be. So what we need is coordination, the ownership, as Dr. Brian was telling us, and then we see how to advance this. If we are seeing that people are not aware, almost above 60%, like we saw the assessment that done in 2023, we believe the existing platforms can help us to structure better using the forums we have. We normally have the weekly community assemblies, what we normally call in Thursaday. We have the community work, Muganda every year. We can use all these existing platforms and achieve at least the indicator of awareness. Yes, financing is needed, and we sure having the best ideas, we can't fail to get how to finance this and achieve the 70% domestic financing by 2030. Our gains would be real and would be secured and do much better. As I said, these diseases are neglected, not because they are difficult to treat, but because of whom they affect. And in a country like Rwanda, we commit to leaving none behind. That word should not sit uncomfortably with all of us. I would request everyone in this room that each of us should leave this room with one commitment, with an owner, a timeline, and a place in plan, as we're alluding to what we had earlier. And I would also take this platform to be an important forum for us. We are going to have the panel. We hear insights from what they are telling us, and I saw it is from different state departments and partners. We will also leave this room with the homework to do in order to get rid of these NTDs. With these remarks, I would declare this annual high-level stakeholders advocacy meeting officially open. I thank you so much.
Let's once again appreciate the guest of honor with a big round of applause. As we close our keynote speeches, I would like to ask you, so I would like, once again, can we do it? You're going to respond, yes, we can. Can we do it? Yes, we can. Once again, loudly, can we do it? Yes, we can. A big round of applause to everyone. Thank you so much. And I would like to, once again, thank all the keynote speeches. And we are going to have the presentation from Radislas. I'd like to invite him. Please, you may step forward from RBC. A big round of applause to him. He's an acting director of NTD and other parasitic disease unit in Rwanda Biomedical Center, and experienced and with a lot of experience in RBC, and also public health professionals and research in Rwanda, system with a strong experience of more than 10 years. Well, welcome. Thank you so much.
Thank you very much. So I will be highlighting what we did the last year as we are having this platform on annual basis. So I will be highlighting few achievements that we have done. We have done a lot that if we want to talk all we have done the last year, we will spend the whole day. But I will highlight the key priorities. So we have been talking on NTDs. I'm sure that we are all aware what we are referring to. These are diseases that are affecting people with the economic burden and others. But if we are saying that we are neglecting disease, not the disease, but it means that you are neglecting people suffering from these NTDs. Those are the people who are sectors to make sure that we can work together to eliminate these NTDs. So they cause many things, including poverty, although they are affecting people with the poor, but they cause more poverty than what people they are having. So including disability, social exclusion, stigma, and the others. So we have a long list on the list that we have in the country. So we have made progress. There are some NTDs which are still prevalent in the country, but others, they are no longer prevalent or they have never been confirmed in the country. So as it has been highlighted, to control or eliminate these NTDs requiring different intervention. We have been referring on preventive chemotherapy, which is known in our setting as mass drug administration, which is happening for STH and Schisto. You are all aware on an annual basis or every 6 months. There's individual case management that we have done by integrating NTD case management in the health facilities. So wherever you can go in the health center, you can get services for NTDs up to the health center. So the diagnostic, treatment, and others, that is how the progress that has been made by our country. They have many vectors, as we know, for other diseases like malaria and others. NTDs have also vectors, including mosquitoes, flies. So we have to work also on vector control as well. The important thing is on wash, because most of NTDs are related with the poor wash. So as we improve wash, we are eliminating NTDs. Yeah, we have experience like a trachoma. Trachoma has been, the burden was reduced by improving the hygiene. We have never implemented MD or something else, even other control measures, but we are no longer having a disease because the hygiene in the country has been implemented. But when you look back, in the year like 2007, we were having cases, but by improving hygiene, now we no longer have cases. So we include veterinary public health because we are having like rabies or dog bite, which is over MOH control, engaging other sectors like Ministry of Agriculture and Animal Resources, or RAB, because we have to work together to make sure that we vaccinate dogs, and on the side of Ministry of Health, we are working on patient, including management and administering anti-rabies vaccines. So we have around 10 NTDs which are prevalent in the country. Some of the pictures you have seen, some pictures on NTDs. I added some word in Kinyarwanda because they are not common. If we keep speaking it in English only, but we have to know them in Kinyarwanda. So we will be referring on intestinal worms. Intestinal worms, that is a group of parasites, including a species like Ascaris, Ankylostoma tertiaris. So as you will see on the pictures, there are 3 which we consider. So you will see some Ascaris. Everyone has seen Ascaris because most people are vomiting it. They are passing it through the stool. So this is common. Others like ankylostoma trishure, so they are transmitted through the skin and they consume blood, so they can cause anemia. So this is schistosomiasis. It can be chronic and it cause ascites. So this is not a simple child. He was suffering from ascites. That is water within the abdomen. And we have some cases, and even Rwanda, the child that died from the schistosomiasis. But the good thing, now we have improved with the MDA. Now we are no longer having these chronic cases. So we have snake bite, so we not highlight a lot, but we still have cases. So we are not targeting eliminate snakes, rather than preventing snake bite and the proper management of the cases. We have dog bite or rabies, although we are showing dogs, but it can be transmitted by cats, bats, and others. So the bad thing is that if it is transmitted to human and it is confirmed, it's hard to survive from that disease. They end by dying. So we make sure that we treat the bite to make sure that it doesn't progress to rabies, because if it is rabies, it is final. So we have leprosy. We have some cases, all high burden districts, like the Bugesera, Sagara, Ngoma, Rusizi. Those districts we are still having leprosy, and the program is doing a lot to make sure that we are progressing toward elimination. We have tenea. Here we focus on tenea solely from the pork, because it can affect the brain and cause what we call neurocysticercosis, which cause epilepsy as well. So we have scabies. It's known as the shishkala. It's affecting people like in schools, in camps, in prison. So we don't have outbreak, but we have some sporadic cases in those areas. So we have podoconiosis called the midido. This is transmitted by long exposure to soil. And we have seen some patients like this one across the country, because we are having cases across the whole country. We used to say that we don't have it because it has been confirmed that there's no ongoing transmission. But last year, when we were doing mapping updates and intervention in those areas, including mass drug administration and vector control, as I said, in those areas. So this is the status. It has been highlighted that we are having a high burden for STH, because STH is much related with WASH. So you improve WASH, you improve development, and then you don't have STH. But if those indicators, they are not at a high percent, meaning like every 10 people, 4 of them, they're having STH. So which is not like low. When we focus on school-age children, 5 to 15 years, they have almost 39. But these findings from mapping, the prevalence was higher in adults. That's why we modified our MDA strategy and we included the adults. So from 2021, we have been conducting MDA including adults aged 16 years and above. So schistosomiasis, the prevalence is not high, but we have around 1,000 administrative cells across all districts. So tenea, as I said, we are focusing from the one from the pork, but there are also another species of tenea saginata from cows. But we focus on this because it can affect other areas like brain and cause other problems. Scabies, I said, they're sporadic. Podoconiosis, we have around 6,000 cases listed during the mapping 2017. Reprosi, we are having around 13 new cases locally within the country, not government, because it is under the social issues. So we don't have many cases, but we should not be having cases for tungiasis, which we call amavunja. But the good thing with improving hygiene or housing, now we are not having many cases. The snake bite, you said we have cases, we still have cases. Eastern province being the most affected, and the western part. Rabies, we still have dog bite around 3,000 a year. And now we are having around 3 or 4 cases of rabies. Onchocerciasis are highlighted. So there are other NTDs, as you have seen on the list, like yours. So people who are older here, yours it's called Ibinyoro. It's not Ibibembe, it's Ibinyoro. It has been in the country a long time ago. The last case was in the 80s. So we are documenting through the Skin NTD project to see if we no longer have them. Trachoma, I said we are developing elimination dossier, as we are not having many cases, and the lymphatic filariasis. It is similar to podoconiosis or limidido, but caused by the parasite. So trypanosomiasis, it is known by tsetse disease. Everyone knows tsetse. So this one was validated for elimination. Now we are doing surveillance across around the Akaya. Where we are established on the site to make new case. But since the validation, we have never identified cases, even imported one. So these are other diseases that we are updating the epidemiology, myostoma, rural ulcer, dengue, and others. So what do we have like STH, or Nzoka Zomonda? So we are having this area being affected. So we need to find out what are other factors contributing to this area being most affected, even from the previous mapping that we have done. Because we're having the northern, the western, and 2 districts from the south, Nyamagabe and Nyaruguru. They are the most affected areas. Wherever we do, we assess the cases during the routine case management within the hospital, it's the same. So there is a need of some additional intervention in these areas to make sure that we accelerate elimination of these NTDs. So we are sure that we are having other species, like I said, Trichuris, which is not responding to conventional albendazole that we are giving. But we have started in the previous MDA combining with the ivermectin to make sure that we can increase the efficacy of the disease. When you see to the progress of the prevalence, we have made a progress since 2008 with a 40% reduction of the prevalence. But starting, if we need to start thinking of elimination, we have to go below 20%. So we hope that the next mapping in November 2006, so the prevalence will be reduced. So that's why we are saying that we need more effort, because we are still having districts with a higher, which are not meeting the criteria for elimination as public health problem. That's why we need to intensify wash intervention, SBC, and modify the MDA strategies. So the schisto, the preference is not high. The national is 1.7 and 2.4% in SAC, 5 to 15 years. But it is across the whole country. When you see to the progress made, we anticipate that the next mapping would help us to develop the elimination dossier. Although we still have some cases, we are anticipating that the results will help us to meet the criteria for elimination as a public health problem. So then you can modify the MDA strategy and go for focal MDA or treating the hotspot. So another activity that you are doing is podoconiosis. Although we don't have many cases, we have around 6,000 cases. When you look at the list, you will not see podoconiosis, but it was included within the skin NTDs with a more advocate to include on the list as NTD. So for us, we have opted to include within NTD program. That's why we are doing intervention with, in collaboration with the Heart and the Soul Africa, which initiated in the management of the disease in the country. So these are the treatment centers that we have identified. We have 14 treatment centers in collaboration with the HASA and UGHE. This year we are developing or creating new 11 treatment centers. At least we'll be having 25. With the aim, when you look at the HSSP5 or NTD strategy plan, the end is to integrate the intervention within a routine treatment. So we are making sure that we create treatment center in each district. At the end, then we integrate into routine management. So we are working with a project. That's why we have seen the representative from Ruhango and Bugesera. Because the prevalence in this district for STH and Schisto were very low, and we were going beyond the elimination as a public health problem and try to assess the interruption of transmission with the intensified intervention in this area. So for Bugesera was meeting for STH and Schisto for elimination, interruption of transmission. So when we say interruption of transmission, this is have the prevalence less than 2%. So that is a very low prevalence. And we are ambitious that we will be achieving this. So the preliminary results, because we conducted a stop MD, they are promising for Schisto. For STH, we're still exploring because of those other issues that we highlighted, including awareness and wash. For Schisto, it's progressing very quickly, but STH, we need to do more. And wherever we have low prevalence, we don't relax. We have to make sure that we are keeping awareness and improving Schisto wash interventions. So we have done many things and working together with the partners, NGO Forum, HASA, and other partners, the districts, and the other partners working on wash in those areas. We were having the youth champions with working on NTD and wash. The training, we trained the community health workers, opinion leaders, lab technician. We trained lab technician because we have already stopped the MDA for Schisto in those areas because we are targeting for interruption of transmission. So then we trained the lab technician to make sure that they are able to detect cases for Schisto, to make sure that cases are well detected and treated. Because if they are not detected, so we might be going back with a higher prevalence of Schisto. So that's why we trained lab technician in all health facilities in the 2 districts. So we are working with faith leaders to make sure that the awareness is not only within health sector or local government and others, but even in the churches. So they know and they are aware of NTDs. Because some of them, they have historical region features like leprosy, when you read the Bible, you will see leprosy within the Bible. So they have to make sure that they are creating awareness on NTDs in the churches. So we are working with the stakeholders, leaders, schools, healthcare providers. We are working with the media because we have a pool trend on NTDs and malaria. The good thing that for us, we are integrating malaria and NTDs on different activities, vector control, awareness, and others. So other thing we did is the celebration of the World NTD Day, which marked the importance of multi-sectoral collaboration to accelerate elimination of NTDs. So we're collecting SNEL, responsible as intermediate host for schistosomiasis or bilharzia in this water body. So it was represented by different partners, including WASH partners. I said that we launched the malaria NTD youth corps, who are working on NTD to advocate for elimination and innovative intervention. I think that then the MC is part of the team of the youth corps and is leading them, if I'm not wrong. Thank you for leading our youth for combating NTDs and malaria. So we are doing another project on the bilharzia storytelling initiative, which is an innovative way to educate small children with the pictures. Because the conventional awareness intervention we are doing, they are not adapted to small children. So that's why we have been working with the bilharzia storytelling initiative, which has shifted to a mass health initiative. Right? So we worked with the selected school in Bugesera, Ruhango, and Gatsibo, which showed the high impact for behavior change to prevent schistosomiasis. So this is the training for lab technician that I was referring to. So we did it in Ruhango and Bugesera, and we distributed the materials for high-performing diagnostic tests, which we call cattle cats, to make sure that they can detect more cases of schisto in this area where we are anticipating to stop MDA. So there are other interventions that we have done, including in mass drug administration. We keep this intervention across the whole country. We are doing the mass drug administration for STH twice a year, every 6 months. And recently it has been integrated into routine community health system. That's the new platform and the new delivery way that we are doing it. We conducted environmental impact assessment for snail control. So snails are responsible for schisto transmission. And later we conducted training on snail control. I think that maybe you have seen some publications, some cases, some tourists complaining that they came to Rwanda and get contaminated by schisto in the lakes. So that is affecting the tourism, not only health, but also tourism. So that's why we advocate even for the country, the government, to allocate some funds to do snail control intervention along most frequented beaches like Kivu, like Muhazi. So we are now starting intervention. We piloted intervention in Bugesera and Ruhango, and doing a scale up in other areas like Kivu and Muhazi. So we are working closely with the Minister of Local Government to the district, where we are doing a lot on WASH inspection and competition. Because a lot they do competition, so there is improvement on WASH. So that's how you will see our vice mayor is there. So everyone is within NTD. Thank you for supporting us. So we are having other NTDs like rabies. This is the bite, the dog bite. So we're having challenges on management, dog bite management. So we have to improve to build the capacity on management, proper management of dog bite and snake bite. So the rabies elimination, it has another strategic plan aligned with the NTD strategic plan. So we trained staff from emergency hospitals, including physicians, nurses, data managers, IDSR focal person. As you can see, we're having collaboration with different sectors, including RAB, WHO, WAG, and others. And now we're able to train 120 healthcare providers across all health facilities. At least we know that although we are doing dissemination, but it's already out. So it's accessible on from developing we are looking at engaging different centers. We'll be inviting cases active to detect cases. The WASH NTD coordination toolkits, which will be disseminated today, is validated. We developed the onco silicasis or river blindness elimination plan, which is validated and being developed for endorsement, and the trachoma dossier being developed. What are we planning? We will update the status of STH and Schisto this year, because we are conducting a mapping in November 2026. The stop MDA, the final report is almost there, and it will disseminate the findings and the way to stop MDA safely. We are adding safely. Because we are looking at how can be scaled up across other districts. So we keep the behavior change intervention and the scenario control, finalize the trachoma dossier, and update skin NTDs. This one they are rare, or we are not sure if they are still in the country. So we thank the WHO for the support. We are having a project on updating the status of skin NTDs and developing the guideline for management. Thank you, country representative. So we are going to scale up the combination of ivermectin and albendazole. So we've been implementing intervention for onco in those two districts. And doing a surveillance in other districts where we have identified the vectors like Nyabihu, Nyagatare, Gesera, Chichukiro. So we have vectors. Those are the black flies. We'll be doing surveillance of health to make sure that we are having a common targets, doing joint planning and implementing activities. I know that we are having those activities in different sectors. Let us work together toward the joint target. Thank you very much.
Thank you so much. A big round of applause to Dadislas Shilimana from RBC for a great presentation. And I know we spend a lot of time sitting quiet, so we need to stretch up and re-energize ourselves. Tumaze umwanya munini twicaye, bikeneye akayagamo gatoya, ndagira ngo duhaguruke. Let's stand up for just seconds. There is a very, very interesting and simple stretch up. Please, let me see everyone stand up. Thank you so much. And I would like on the technical part, could you please present for me my stretching moment? There is one of the YouTube guide for stretching. a very interesting one. Are you ready for this? So, he's going to guide us. We do what he do. Let me say one like this. We are starting, please. Okay. Increase the volume for me, please. Be quick. Let me see. Yeah. Quick one. Quick. Come. Let's move on. Let's move. Come on. 1, 2. Come on. Come on. Again, 1. Down. Clap. 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 Come on. Thank you so much. Thank you so much. Thank you so much. Clap for yourself. That was really nice. Wow. Wow. Those music sometimes remind me my time in nursery. Thank you so much. Remind it. Please wrap a bit up. Like 5 minutes. Yes. Another big round of applause to him. Yes. As the technical team is working on it, I have a story. When I grew up, I learned about washing hands. I thought it's like a simple work. Just go on the tap of water, just put some soap, and then that was the cleaning of my hands. And I came close to steps of washing hand challenge. And I found it's 7 steps of washing hands. Do you know 7 steps of washing our hands? Or we do like this. Who do like this? And then we are done. So there is 7 steps of washing our hands. Who knows? In COVID-19, there were like a trend of hand wash challenge, how we clean our hands. So most of us, we just put soap and then we clean our hands. But there is 7 steps where you start by putting some water, you add soap on the palm, you start by rubbing up the soap on the palm. Third, you go behind, then we go in between of our fingers, then we go here, then we go just in the palm, and then can we do it? 1, we start, put some water, put some soap, rub it, Go behind. Go in between your fingers. Go on your thumb. Go in between the hands. Then put some water. Now my hands are clean. Clap for yourself. Clap for yourself. Now our hands are clean. So remember that. So are you ready?
If a woman joins, I'm sure it's going to work.
Any women in the house? Technical one. While they're working on it, okay. Who is curious about this gift here? Who is curious?
Thank you very much. This is Dr. Emile Ngabo. I'm a physician, and I'll be presenting to you the water. It shows so it shall not take long, and we shall be going through all of those you can see on the screen. If you can see, the NTDs, next slide please. If you can see the NTDs burden per million inhabitants, the African region looks blue or somehow green. So it means we have the highest burden of the NTDs. And if you can see, it is above 7.5 dairies. That is to mean at least 7 years of healthy life, which is lost in Africa compared to the other regions. And next, at least 80% of the global burden of NTDs is concentrated in only 16 countries, and that is, of course, low and middle income countries. That is Africa. So next, if you can see from 2008 up to 2020, someone with the technical team, next please. So if you can see from 2008 up to 2020, there has been a progressive improvement in the soil transmitted. There is a hope of elimination in the near future. And again here, for the schistosomiary as the total risk areas, I mean the total risk zones. And if you continue on the next slide, there is a team which has been working together to create what we call the coordination toolkit, which is a practical guide to strengthen coordination between the WASH programs and even the NTDs programs. And you can see the objectives. On the next slide, you know, schistosomiasis is actually transmitted through contact with contaminated fresh water. That is to mean elimination of schistosomiasis is actually not possible without integrating the programs that are dealing with the water, I mean with WASH programs. And actually on the last but one point on the previous slide, treatment clears infection, but it does not actually eliminate those causative agents. I mean, if we say snares, if you treat people with schistosomiasis, you'll not be moving away what actually is in the transmission pathway. Here you can see the policy and strategic framework. We have global guidelines, the WHO NTD roadmap. We have the WHO Global WASH Strategy, the Kigali Declaration that was launched some years ago, And on the national level, we have NST2, HSSP 5, the National Water and Sanitation Policy, and we also have the recently launched NTD strategic plan, which is up to 2030. If we go next, we have giving us the guidance, the district. I've seen the vice mayor here reading us in the district wash committee for planning, and also on the sector level, at the local outreach coordination, and even on the community where everything is actually done. On the next slide. So we have different areas of integration. On the next slide. There is preventive chemotherapy that can be given to the community. There is sanitation and safe water management. There is safe water access. Management is actually another good pillar or another area of integration. So here on the implementation approach, on the next slide, we shall be seeing the integrated delivery, which is a very good cornerstone, where the warming, sanitation, safe water, hygiene, and planned to be delivered together on the next slide is a very good approach instead of fragmented systems. On the next slide, please. We also have community platforms that our high-level official has been discussing about. The community, on the next slide, please, the technical team. On community platforms, there is Umuganda, there is community health workers, there is cooperative, there is faith-based organizations. You know, the faith-based organizations are the people with the hearts of our community. In case we engage them and we collaboratively work together, we'll be very sure that they're going to help us in the social and behavior change communication approaches. We also have the schools to be engaged. We have the environmental management. So there is a lot that will be discussed in the toolkit, and that will help us to implement the NTD and the WASH program integration. So then on the next slide, we have monitoring. We have to monitor and measure whatever we are doing. And we also have to make sure that everyone is held accountable of what is being done by using the quarterly joint review that is available in the toolkit, the coordination commitment, which is reflected in Mihigo, and so on. So thank you very much. We also have the capacity building to be integrated with the existing platforms. And on this slide, you can see we are disseminating the toolkit. After disseminating, there will be joint planning together with the local administration. And next, it shall be scale up to other districts and even consolidation. So in the doing quarterly reviews. Thank you very much. I can say that together we can eliminate NTDs, and subsequently or eventually we shall eradicate them as well. So let's say we can eliminate NTDs, we shall be saying, yes, we can. We can eliminate NTDs. Thank you very much for your time and consideration.
Let's once again thank Mugabo for a good presentation. Another big round of applause to him. Now, we are in an exciting moment. As I've been saying, we are going to officially launch our 2030 strategic plan. And I know everyone was really excited to understand what is inside, what is in a gift. Hold on once again, please. Bring back to 10. Bring back to 10. We're going to start. So we have, let's start it. Please, let's start it. Replay once again. Start once again. And before we start, pause please. You can reduce the lights. We're going to Kumatara. can reduce the lights so that we can see on the screen. So it's a surprise. So we're gonna have a countdown to 10. I will tell you when to start. Then we get introduced to the strategic plan 2030. And I would like to everyone to look on the screen to see this small and summarized highlights of it before we open up our gift for today, as it's wrapped it up, and we're gonna be helped by the ED to help us unveil it and also invite our guest to open up it. Once the lights is off, you can start the countdown to 10. Great. Great. So let's do it. Let's start the countdown, and then we start it. 8, 7, 6, 5, 4, 3, 2, 1. Get a look in it. Wow. A big round of applause to it. That was a small highlight. I would like to invite our ED to help us in this moment.
Thank you very much. I think now lights can be on. I'd like to invite our guest of honor to just come forward. WHO, Rwanda Biomedical Center, the Minister of Health, the Minister of Infrastructure, the Minister of Environment in the room, community health workers in the room, HASA, CSO representative, the UNDP in the room, and the GIZ, the Germany embassy. Yeah. Charlotte, you're welcome. Do you have community health workers? UNICEF? Who is missing? Women representation from the community health workers. So as we move to the launch of the NTDs Strategic Plan 2026-2030 and the WASH National Coordination Toolkit, I want to request the guest of honor, RBC and WHO, to unveil what we've prepared for us. In this event, we are talking about multi-sectoral collaboration. We cannot eliminate NTDs by only keeping our eyes to the Ministry of Health. We need to make sure that we work together, we join our efforts, we plan together, we monitor together, we report together, we evaluate ourselves together. So this is the time. We need to move from talks to actions. Today is a commitment that we've just started. We need to, by 2030, we need to see a Rwandan free from NTDs, and where every Rwandan is protected from the diseases that are are caused by poor sanitation, wash, and hygiene. Thank you so much. You're welcome. Just take us through the next session. Can we all stand up? Please, let us stand up. Thank you so much. This is the day, we call it a day. Is it? We call it a what?
A day.
Yes, we can.
Yes, we can.
Yes, we can.
Yes, we can.
I can't hear women in the room. Only women. Yes, we can. Male. Yes, we can.
Yes, we can.
Can we all say it? Yes, we can.
Yes, we can.
Thank you so much. Let me invite everyone to come in front and we have a group photo.
Yes.
A
Everyone
group
is
photo.
invited, please. We have to have a common group photo from
Before we do a group photo, we have some documents here which we want that
it just summarizes all the strategic plan. We take time to read it and make sure everyone get a copy or a soft one and read it to know all the areas.
here we have the coordination toolkit.
Let's once again appreciate everyone who contributed to make this possible. Partners, governmental officials, civil societies, community members.
So I think the team in front can hold their documents. Please don't keep these documents in the drawers. Go read and make sure that there is a contribution you're going to make to our country. When you talk about the country, we mean the communities. Thank you.
Let's hold it like this. Amazing. We can first take this one and then the group photo will be taken here on the backdrop.
So all of you, can we join? Some people can be behind, others can be in front. Oh, there's
We can move there. Or guest, you may stand in front. Amazing. Make sure you grab your book of strategic plan and toolkit, or you can take a soft copy of it. Amazing. Yeah, we can start going behind. Please, everyone is invited. Ntihagire usigara. You may please join. Everyone, please, I want to see your beautiful faces and handsome faces with a good smile and excitement and greatness of this achievement. Wow. Then we're gonna have another one saying, yes, we can do it. Great. No, 2, 3, go. Yes, we can do it. Thank you so much. So So before we go, there is one more picture that I want. Have it. I'd like to invite.
Can we all have a seat? Thank you, Ladi. Thank you. You know, I love your name, huh? That's why I'm calling you. So we are moving to the next session, which is the last. I know you all want to leave, you have some other things to do, but we are moving to the next session, the panel. And the panel is going to last for 45 minutes. After 45 minutes, then we wrap up our session, and then we go for other engagements that we've planned for the day. People behind, can you please focus? People behind, can you please focus? Thank you. Doctor, over to you.
Very brief one, but interesting one. So I would like to call upon our panelists for today. We're going to have on the panel representative of RBC. Once again, let me call upon Dr. Radislas. You may come once again. Yes. To welcome Dr. Ishimi Albert. He's Head of Department of Disease Prevention and Control, Rwanda Biomedical Center. Let's once again give it up and give a big round of applause to him. Thank you so much. Applause. And also we are having Dr. Mugabo. I would like to invite you. Another big round of applause. He's from Team Leader for Disease Prevention and Control, cluster in WHO, and also, if you follow all that we have by now, gaps that are still there, and also what needs to be done to ensure that NTD elimination and WASH integration remain integrated in national priorities.
WHO NTD roadmap, you will see count in sanitation. And this is really clearly highlighted into the NST. And this is the guiding specifically in terms of it's an opportunity for us. First one of agriculture, we have plans, our targets. Thank you.
Thank you so much, Dr. Albert. That was really a big round of applause to him. And as we heard, there is a really good news that in our national plans, even in NST too, we already have that sector that talk about NTDs and WASH. And that's showed the national commitment toward this cause, but he also highlighted one of the key challenge about financing and collaboration, especially that rely on local financing and how we could mobilize ourselves to sustain the finances. That brings us to our own Dr. Pascal. You are really experienced in health financing, especially in your work at Ministry of Health. We would like to know what could be done at ministerial level, at national level, even at partner level, to ensure that we have a sustainable financing that is going to help us achieve 2030 target for NTD and WASH integration.
Thank you. Thank you for this event, first of all, because we are progressing toward thus to tackle the issues that we are finding in neglected transmission diseases. So the government, first of all, the government has a budget for NTDs, and we have seen that it is going throughout by increasing. And we thank also the End Fund because is participating actively on that financing system. And when you look at our health sector strategic plan 5, HSSP 5, has emphasizes on NTDs. And it is shown how to eliminate, how to interrupt the transmission. And also for this, we have a clear guidance for interrupting, and that has led us to this strategic plan of NTDs. So the Ministry of Health is recognizing that this has to be empowered as other programs to be empowered in order to tackle those diseases. So the finance, we have to work together with other institutions, as has been said previously, in order to tackle that diseases. It's not only the health sector that has to tackle it, but with partnering with other institutions, other ministries. And you know that in WASH, the safe water, it needs infrastructure, because we need to build something to have that clean water and the sanitation, even hygiene. You know that, for example, for the hygiene, we need the environment that helps us to have the clean water and the sanitation. For example, to have clean water to wash, and for example, for brushing, you need something to go toward. So it's complex, it's comprehensive, it is not just a part. We have to create an environment that where we have a system that has to lead, that to eliminate the neglected transmission diseases. So regarding the financing, we are on the path. There is a budget. On our ordinary budget, we have a fund for that. And we have other partners that are putting funds. We recognize that it was not well financed, but when other partners are going to come in, I think that it will be improved. Thank you.
Another big round of applause to Dr. Pascal. Here, the interesting part of this panel is that we are hearing good news from each panelist. We have heard that there is already some funds that are there, even though they're not enough to cover up all the impact that we want. But the good news is that there is some commitments and finances from different partners, which is really a good news to an opportunity for us. But he also talked about local reliance, domestic reliance, which brings us to our community. One of the investment the country have is us as the citizen. So if we want the impact to be sustained, this brings us to abaturage. So we have community health workers. I want to ask this question in Kinyarwanda, because it's going to engage them and to make it easy for them to understand. Nkuko nari mbivuze, umuturage nibwo butunzi bw'igihugu. Twavuze ikibazo cy'uko hakiri ubushobozi buke mu kurwanya NTDs ndetse no kwimakaza isukura, ariko turaza kureba ngo ese ni gute umuturage yaza ku isonga ni gute yafashwa, ni gute yakigishwa, ni gute yahabwa ubushobozi bwatuma noneho ya ntego dufite yuko 70% y'ibizaba bikenewe kugira ngo tuhashye zino ndwara bizaba dushobora kubyikorera twebwe ubwacu. Niyo mpamvu nifuza kwakira Godfrey Kaigana from Minarok to help us respond on that question. The floor is yours.
Thank you.
Thank you.
I don't know whether I should respond in Kinyarwanda or English, but I think I need to mix.
Yes. Yes, please.
Yeah, uburyo bwiza bwo kubikora icyambere ni ukubanza kwigisha abaturage.
Yes.
Ukabasobanurira izi ndwara tuvuga, wenda umuntu yavuga indwara zirengagijwe. Zandura zite cyangwa zititaweho, zandura zite, umuntu yazirinda ate. Iyo tuvuze abaturage bikaba biri ku rwego rw'umudugudu n'akagari, cyane cyane nk'abajyanama b'ubuzima, abayobozi b'imidugudu, bakaba bazi uburyo zandura n'uburyo bashaka kuzirinda. Icya kabiri, hari wenda tuvuze nk'uburyo bwo kuzirinda ko bagomba kugira isuku, bivuze ko bagomba kuba bafite amazi. Noneho hakazamo leta kugira ngo ibegereze amazi kandi ahendutse, access na affordability y'amazi. Bigakorwa n'ubundi akarere kagira planning na budgeting process, cyangwa bagira ingengo y'imari buri mwaka. Ariko tubikora gute tukamenya ngo ese ni hehe hababaye kurusha ahandi? Ikibazo cy'amazi cyo kirahari, ariko kuko udashaka kugikemura umunsi umwe, ukamenya ngo turere dufite ikibazo kurusha ahandi n'utuwe. Ikindi nk'uko icyanafasha ngira ngo nuko twajya twerekana ingero zaho iyi ndwara yagejeje abantu. Urugero tukavuga tuti umuntu ujya mu gishanga guhinga umuceri, dore ingaruka yakuyeyo kubera ya ndwara, dore aho byamugejeje, byatumye arwara, umusaruro waragabanutse cyangwa yaranapfuye. Kugira ngo abaturage iyo bigeze ku buzima noneho bagutega amatwi bakabyumva. So ni abajyanama b'ubuzima umudugudu ni 4. Babyumvishe bagafatanya n'ubuyobozi bw'umudugudu n'amasibo, ariko bamenye umuturage turamubwira iki, ese ibimenyetso by'iyi ndwara cyangwa by'izi ndwara ni ibi, twabyirinda gute. Noneho inzego za leta kuva ku karere, umurenge, uretse kwigisha abaturage, ariko noneho no gukemura, gushyiraho uburyo butuma bashobora kwirinda. Urugero navuze isuku, babigisha ariko banafasha abantu kubona ubwiherero bwiza, amazi, isuku ikaba umuco. Noneho tukareba n'ahahurira abantu benshi, mu mashuri, kwa muganga, aho hantu hose message ikagenda. Ariko hakaba ari n'uburyo kubwira umuntu ngo gira isuku adafite amazi ntacyo umubwiye. Turabizi ko yenda uvuze ngo umuntu ku munsi akorera umubyizi yabonye 3,000, ijerekani y'amazi ni 1,000. Ese aragura amazi akeneye kurya? Kuvuga ngo babona amazi ahendutse, noneho tunabigisha basange babishobora kubishyira mu bikorwa. Ndumva ari cyo nakoze.
Thank you so much. A big round of applause to Godfrey. That was really a good response. I want it to be highlighted in Kinyarwanda because for community engagement, we always engage community of workers, abajyanama b'ubuzima baradufasha. Ndagira ngo tubahe amashyi, by the way, tubashimire for their continuous support. Mwarakoze cyane. This brings us to, you talked about capacity building, you talked about community engagement. This brings us to those partners that are working on the ground and working with the local government. Those are civil societies, associations in different scope of work they do. That's why I would like to ask Dr. Eric Nyongira this question. As civil societies, how do you see your role in engaging the community, local leaders, and also even between you, collaborations to come up with that advocacy capacity building, and also community engagement for NTDs and WASH.
Thank you, Tonga. I will excuse myself because my response is going to be in English, but where possible, I will try to mix it in Kinyarwanda. I think all of us seated here, growing up in Rwanda, growing up in other communities in Africa, we've heard of the intestinal worms, or the so-called inzoka zo mu nda,
Yes.
or possibly bilharzia. I also heard of them when I was growing up, and also getting the tabs from schools or at the health center. Anyone could understand that we are fighting the intestinal worms, or we are preventing them. I took the medications or the tabs as everyone was getting, but I was not able to understand clearly what this means, or the linkage to some of the effects, for instance, stunting, or even how these diseases are transmitted in the community until I got in medical school. So during my training in medical school, I got to fully understand their effects. And I will probably reflect a bit on what the representative from Mineral said. Our communities don't really understand the effects. And if we're able to communicate the risk communication, what are the effects if we are not acting today, or if you are not taking into consideration the preventive measures that we are being communicated, we won't be able to eliminate them, to say the least, before we go to the eradication. I'm speaking today on behalf of the civil society organizations and also some of the other partners that are working on the community level to make sure that the communities and also the partners are joining hands towards the prevention of the NTDs. The diseases are called neglected, but the communities that they are affecting are not neglected, because every life matters, and we as the partners or anyone who's working in the health sector or in the healthy development of the citizens truly understand that no life can be ignored at the expense of these diseases. So what we do, I will frame them in three major key points. I would say that we carry the last part. So today or tomorrow, the government will be delivering the medications, or they will be giving tabs in the community. But the medicines arriving in the community, at the health center, at the school, its understanding will not arrive on the same day. And that reflects to what the PS recently mentioned, that the majority of the community members, if we talk about 60%, they have not really heard of bilharzia, or they don't really understand the transmission routes of the intestinal worms. This is a major key gap. What we did, it was the evidence generation. Do we really have this gap? That's where the research comes in to generate the evidence, where we are having the gaps. Like the communities are not really understanding the transmission routes, or even understanding why we are giving them the medications. The presentations given here show that the medications might have been given in the last 15 years, but the understanding was not coming with this. And that's where we first come in to make sure that people understand the gaps that are there before we even set or roll out the interventions to educate the communities, and also moving forward to the sensitization and the awareness. The second one, I would say that, speaking as a physician as well, the medicines treat today, but the wash will prevent tomorrow. Imiti butuvura uno munsi cyangwa se iradufasha kurwanya indwara uno munsi, ariko isuku n'isukura nibyo bizaturinda ejo. Yes, because if the medicines are being given to the children at a given school, or at some of the community members are getting them, they will really have a good uptake. We are having the numbers around 80%, 89% of the uptake, but once we come tomorrow, we shall also give them the medications again, or the next quarter, we're giving them the medications again. But that part of WASH is not really being strengthened enough, and it is the key point or the key measure towards the prevention. And when we come in as the civil society organizations, of course, you cannot instruct a family to probably make sure that they are taking into consideration wash, they should wear shoes before they go to the marshland, or they should use or construct a proper latrine. Sometimes they need to hear this from the people they are already conversant with, the people who live with them on a daily basis, the people who understand their struggle. And our presence in the communities helps us bridge that gap to make sure that the communities and the families understand what needs to be done, and also at least also keep in mind that this is done for them, not for the leaders who are giving them the medications. And the last key point I would like to say, we also sometimes say what the government is not really saying. So today we might be running a campaign, the Mass Drug Administration campaign, and once the government reports what has been done, we also need to show them some of the realities that we've faced on the ground, and that's where the advocacy comes in. We are not contradicting the numbers or the presentations the government is putting in place, but we are showing where the gaps are to ensure that at least on the next round of the campaign that we are going to do, or the next intervention that we are going to put forward, will be a correct one and also response to the gaps that have been already given. And through the capacity building of some of the actors we have in the communities, we are able to correct those evidences and ensure that we keep them in check, but also ensuring that the advocacy that we are putting forward is also really responding to the issues the government members or the community members are really facing. The last one, I would like us to focus on one simple story. Let's suppose that we have two villages at a given district in the country. The first village, we're giving them the medications during this trimester, and we just leave. And in the second village, after giving them the medications or the tabs during any campaign, we go back again. We bring the community health workers, the health champions, the faith leaders, and also all those other actors on the community level. They go back to the community members, they educate them, they work with them to fix the latrines, they teach them how to wash hands, and ensure that they understand why all of these are being done. In the next round, we might probably come back and see that the second village was able to succeed in a way. They all received the same medications, but the second village owned the solution. That is where the power of the co-creation comes in, and that's where we are moving forward. It's good enough that we have the community health workers in the room who have been walking that talk and ensuring some of these solutions are really sustainable, and that's how I would frame my solution. Thank you.
Thank you so much, Dr. Eric. Big round of applause to him. Like a takeaway from what he said is that one of the measurable things that we have done is drug administration, which was really a successful implemented program. But do we really need medication for sustainability, or we need to set strategy that is going to prevent and eliminate these NTDs? That's how you said, gutanga imiti biratuvura none, ariko kwigisha abantu isuku n'isukura biraza kudukingira none n'iteka ryose. Let's give once again a big round of applause to him, to Mushimire. That brings us to, you talked about some data of people knowledge about NTDs. You talked about research and how you have identified gaps that we have. That brings us to academia. Like research and data-driven decision is the key to successful decisions that are going to change in this next strategic plan 2030. Ms. Olive, I would like to give you this floor to tell us the role of research, role of data-driven decision-making, and how you're going to engage community to be part of the daily research and data taking that we need to make sustainable and reliable decisions.
Thank you so much. A lot of panelists say about data, but one thing we forgot is how can we include the people who have lived with experience. We are including the community health workers, but who is the victim? Who is marginalized people? If we include them in data as the source of information, but we are not including them as a part of people who are providing the solution, are we including them all? No. So how can we include them all? Sorry. How can we include them all? How can we include them? We agree that we have Umugada, we have inteko z'abaturage. We saw that neglected tropical diseases is not only the health issue. There's rural agriculture, there's veterinary. We have to find a way of doing things in a holistic way. For instance, if we are going, we saw a lot of images from RBC presentation. Some of are related with our belief. Can be anyone from here have ever heard Amarozi. So if we are going to do in as the scientists, and we forgot the people's, the community belief, and we forgot including the herbalists. Are we doing it all? We are leaving something behind. So the researcher team, academia, or institution, we have to find a way how to tackle every challenges we have been facing. Bukesera, we piloted this intervention, and it was successful, but we faced this challenge. How can we tackle the challenges? We have to include the marginalized people. We have to include the people who lived with the experience for more to find a solution. So another thing is how we are calling all of us the stakeholders. How can we hold each other accountable? If we have the same goal, if we have the same priorities, if we have the transparent feedback, so who is going to hold each other accountable? If we involve the community can tell us, yes, we are giving us the deworming, but we don't have water. You're asking us too much. At the government, local government, half of ministry, we have to find the solution together with the local communities. We have to include everyone, I think. Thank you.
Thank you so much, Mrs. Olive. A big round of applause to her. Thank you so much. As she highlighted, is that research and it is a key factor for decision making, and also we need to go down and engage those marginalized and affected community, and not just taking data from there. Like you are in Kigali, and then you are setting data for local people. So we need to go down and grab real-time data to make impactful decisions and plan. So this brings us to all the partners that are really needed to make impact. So we've been talking about collaboration, multi-sector engagement of partners, but we do have a lot of partners in NTD prevention. But are they collaborating daily? Are they working together daily? Are they putting their hands together? Everyone with their energy and expertise to come up with a holistic approach to NTDs and WASH integration. That's why I would like to ask Dr. Gilles, you have an experience in disease prevention, in epidemiology, and as part of WHO, what could be done to engage all the partners? How could we collaborate together to make a sustainable and holistic impact toward NTDs and WASH integration?
Thank you, moderator. I also thank the organizers of this workshop and this panel. And thank you for the questions. So I think my task is easy because a lot of people, my colleagues, have elaborated on the NTD prevention, the planning, the financing, and so on. But I wanted first to make clear what we want to achieve as a country, including the partnership, is really the impact you are saying is the elimination of NTDs. So from scientific point of view, from programmatic point of view, are NTDs eliminated? Can we eliminate the NTD?
Yes, we can.
The answer is yes. And we need to be focused on that impact, the elimination of NTDs. We were talking about the MDA. I think MDA has been implemented in Rwanda since 2007 or 8. That was it was by targeted location or district, but later on it became nationwide intervention. But I want to really appeal. The reason why we have been implementing the MDA since 18 years, it is the failure of the prevention. Because the medicine that are given to communities, they treat, they are effective. We are not talking about resistance, they are effective. But it requires only 3 months, 4 months later, they are again infected. So we need really to put our hands together to say we need to eliminate the NTD. We need to prevent. So if we want to achieve an impact, we need to understand where we are and where we want to go. And I really congratulate RBC, the Minister of Health. We have the NTD strategic plan, 2026, 2030. And the goal is to eliminate the NTD. It's possible.
Yeah.
So as we have that document, it is a guiding document for all of us. So we had a chance to discuss among stakeholders. This is a strategic plan for the ministry, for RBC. How much can we achieve if we implement the strategic plan and rely only on the health sector? How much can we achieve? Is very little. I give an example, like rabies. We have around 3,000 dog bites. So if we want to eliminate rabies, we need to make sure that every dog is vaccinated.
Yes.
And we have also to have the responsible dog ownership. So the Minister of Health, that is really beyond the Minister of Health. We have so many examples. That is why, after developing the National Strategic Plan, we said it is very good to be clear of what we can achieve as the health sector, but we need also to be clear of what we expect from non-health sectors. We have so many ministries concerned. The Minister of Environment should be on the first position because these are problems of the environment. We have the Minister of Agriculture, the Minalog, and so on. That is why we are very lucky in Rwanda. We have guiding documents, but now the ministry has commissioned to develop another document that is the multi-sectoral collaboration and accountability framework. That document will be very clear of what the ministry is supposed to do to eliminate the NTD.
Yes.
It will be very clear for the ministry, for other ministries. And it will be very clear, even attractive to partners, because you are talking about partnership. I think if one is very clear where we want to achieve, even if domestic finding is declining, we'll have partners interested to see how Rwanda can eliminate the NTDs. So partnership is very important. We need to be clear on the mechanism for coordination and accountabilities, and we need really to work together. We need, let's give the last example. We saw around 6,000 of podoconiosis cases. The prevention is to have shoes, wearing shoes. How can we educate our farmers that they can do farming but wearing shoes? I hope in the next workshop we'll have the private sector.
Yes.
If we don't have the manufacturers who are making shoes in Rwanda, so we'll be going around for another year or 2 years. So really partnership is very important, but it has to be clear in terms of investment we are making and the result we want to achieve. Thank you very much.
Thank you so much. So you highlighted a really, really interesting point. There is a saying in English that say, one tree cannot make a forest. Even though it's a tree to be in a forest, but one tree cannot make a forest. Or no man is an island. So we need to think and see that perspective also in NTD and WASH integration. Let me give you an example to just waking you up. Who remember the time of COVID-19? It's a really clear example. Police was engaged, local government was engaged, private sector was engaged, civil society was engaged, youth volunteers was engaged. Everyone was there to support the implementation. And only in 2 years, we've been able to succeed to eliminate COVID-19. This is a clear example that even for NTDs and WASH, it's possible. Can we do it? Can we do it? Thank you. So let's go on the last question. It's for everyone. It's gonna be just 1 minute or two. Like briefly, we learned, and also you highlighted different perspective depending on your scope of work. But we need to hear like two key commitments, not words, like clear commitments from your institution or your scope of work out toward NTD and WASH integration 2030 target. Clear, like two key and realistic commitments from your institution and scope of work. Let's start here. Iki kibazo reka nanone ngivuge mu Kinyarwanda, ni nacyo tugiye gusorezaho. Turifuza kumva from our good panelist kutubwira ibintu bibiri byakorwa kandi babona byakorwa koko kugira ngo tugere ku ntego yacu ya 2030 target for elimination of NTDs and WASH integration. Thank you. Thank you.
Thank you for the question. For us, as we have said many times, the partnership is very, very key. As everyone knows, it's not only the health sector that can help to interrupt the transmission, to eradicate the condition, the diseases that we find it. You know very well that we have many bacteria, many parasites, many fungi. All those are in the environment. So we find it in agriculture, we find it in forests, we find it in houses. So there is a need of clean infrastructure, clean environment to help us to eradicate those conditions. So the partnership is very, very key. And also, as we have it throughout our presentations, the STH, the helmets that are there, it requires to be supported because, first of all, we have to create awareness among the population. Once the population is aware, then it becomes easy to tackle that diseases. Without that, the consequence is poverty. The poverty, when the poverty is there, it means you are increasing also those diseases. So this awareness can be done through other institutions. There is education, Ministry of Education, to be taught in schools. And we have the Ministry of Local Government that has the population the mandate to tackle on that issue because it helps to get to a big number.
Yes.
Yeah. So also the preventive treatment. So when you create a mass drug campaign, that helps to prevent about that diseases. So this said, we need many, many institutions to participate in. Thank you.
Thank you so much, Dr. Pascal. He highlighted about collaboration and partnership. That's first commitment. We also hear from Dr. Albert.
Thank you very much. So in terms of commitment from our side, as a custodian of the technical part of the program, one, we commit to scale up successful interventions from what we tried in 2 districts, Bugesera and Ruhango. We'll do our best to make sure whatever has been successful is scaled up. But again, we have to be more targeted. So wherever we are going to scale up, we need to have clear criteria why we are going there. Secondly, we can guide agriculture, we can guide the local government, so we commit to improve on that through different ways, using the existing platforms, or I did like the idea of that framework, which is going to be clear, and then everyone will be able to monitor who is doing what, where, and how far. So at technical level, we promise you to improve, and we believe it's going to help on our implementation. Thank you.
Thank you so much, Doctor. Commitment 1 is scaling up. Second, coordination of stakeholders. Mrs. Olive.
Thank you. As we are eliminating NTDs, let's take an example as you are baking a cake. Everyone is bringing in the materials, the sugar, the flavor, and the work. Let's bring in the community voice as we are baking the same cake. Not let the community be the one who is going to taste the cake. Let's put the effort in the work. Thank you.
Let's not make the community bake only the cake by themselves. Okay, collaboration.
Okay, so you know that WHO is the secretariat for the ministry, so we are there to serve, but we can commit more on advocacy, partnership for real result of ending the NTD. Thank you.
Thank you so much. Advocacy. Let's hear from Dr. Eric. Commitments.
Thank you, moderator. I'll probably civil society organizations is to keep bringing the community voices into such platforms and also ensuring that the community voices are institutionalized in those platforms, and making sure that as the lived experiences carried from the communities, they are also brought into such platforms where decisions are being made. And the second one, which is even a clear one, the colleagues here on the panel talked about how they will be scaling up some of the interventions, but those interventions are going from top to down. What we commit as the civil societies is to keep the actors in check. How? Through carrying the community voices and also the feedback to ensure that they are being given to the services that are delivered to them through the community-led monitoring initiatives that we've been doing, and also ensuring that they're also reflected in the NTD sector as well. Thank you.
Thank you so much, Dr. Eric. Lastly, Godfrey.
Thank you. As commitment, one is to continue and expand community engagement, to understand how to prevent these NTDs. And the other one is through district planning is to expand access to affordable water and sanitation facilities. So I think if we can do this, plus what my colleagues said, we can reach the 70%. Thank you.
Thank you so much. As we wrap up, I'd like to thank our panelists for an amazing panel discussion that we had. Let's give them a big round of applause and appreciation for a great panel. And even though they have a lot of their commitments, they cannot make it without our engagement and collaborations. Let's promise them that we also commit ourselves to make it. Can we do it? Let's commit ourselves to their commitment that we're going to support ministry, RBC, civil societies, and also academia. Can we do it? Loudly, lastly, can we do it? Twabikora? Yego twabikora. Twabikora? Reka tubashimire cyane n'abashimire. Thank you so much as we close. And for the sake of time, we're going to get the closing remarks. But for the questions, Q&A, our panelists